Hi, my dear friends. My name is Dr. Anna Brodsky. I practice NHS medicine as a GP and I practice anthroposophic medicine privately. Today I propose we talk about therapy. The reason we must talk about it is because I see a lot of my patients who are spending time and money on it and they're not getting anywhere. They say it doesn't help them or it hasn't helped them. Now, the traditional therapy, usually such as psychotherapy or counseling, can be really useful if you have a therapist whom you can trust, who has empathy, who is not patronizing, and then they can help you put all your past experiences which were painful into context and maybe even find a way of looking at them to appreciate how they benefited you. There's even an expression, turning scars into stars, and that's an empowering experience. So that is precious, but a lot of the time talking about past difficult events, even trauma, just brings more pain and it perpetuates it. And this is the very problem anyway, because when we've had some adverse event, even trauma, and most people that I know have had adverse events or traumas, so it's relevant for everyone. Those events alter how we think, they alter how we feel, and they alter how we behave. So just talking about trauma or difficult events is not going to undo that. We have to work on different levels, and to understand what levels we have to work on, let's recap on anthroposophic perspective on the human being. So we have spirit, we have soul. This is where our feeling realm is, or astral body. It is the same thing in anthroposophic terms to simplify things. Then we have our energy, and our energy, of course, is called the third body in anthroposophic terms. And then we have our physical. Now, ask yourself a question: which level is affected with traumatic events? I think traumatic events, this is why they're so difficult, because they affect us on all levels. So our thinking is affected, our feeling is affected, they imprint themselves on our energy or our etheric body, and this is why we find that we behave in a repetitive fashion. We have repetitive thoughts, repetitive feelings, and same response to the same stimuli, where we cannot just move beyond trauma and forget about it. Because it's actually gone into our energy body, and this is why just talking about it is not enough. We have to work on all these levels. So let us talk about techniques that can help us undo the trauma from our energy body. So one of the techniques is called EFT, or emotional freedom technique, and you may already know it. I won't go into whole practice of it, but I'll just give you gist, simply because you can get a therapist for it, or you can find some videos and learn it online and do it on yourself. And with a therapist you may only need 1 or 2 sessions, because then you can do it on your own as well. So you would do a setup statement using your karate chop, tapping on the karate chop, saying how you feel. So I feel very sad. So for example, I won't go into examples about something. You feel very sad and you grade it out of 10 in terms of intensity. So 5 out of 10, for example, I feel very sad. You describe how you feel, you use appropriate language so that it really expresses your feeling at the time, and then you start tapping on certain energy points. And you do several rounds and you find that the intensity goes down. The beauty of this technique is, one of the beauties is that you can work through current situations, immediate emotions, but you can also tune into past events or situation in life. So for example, a certain situation that produces intense feeling of anger or sadness or upset that may be in the past or present, and you can work your way through that feeling. And you often find that the feeling transforms. So you may start off by feeling angry and then go into, actually I feel sad, and you can do a round of tapping on that. And you can do it on a regular basis to help yourself free yourself. So this was EFT. There's also TAT, which is great. And again, I won't go through the whole technique, because instead I will link 3 videos The author has done 3 videos on how to do it, and she's put them on YouTube, so very generously. So you would take your hand, put it at the back of your skull, you would put fingers on your forehead in a particular fashion, and again you would talk yourself through how you feel, what happens, how you feel, and then you will incorporate the fact that it was all circumstantial and the truth is different, because how we perceive the reality at that traumatic event was just circumstantial, and we have made impressions in ourselves that no longer relate to the present reality. So you can actually incorporate with this technique something new into your system and change the energy, it is a beautiful technique. I really love it. And then of course there's EMDR. This is a technique that you need a therapist for. It kind of uses your eye movement to, undo certain connections in the brain and help you very quickly move away from these traumatic events. So I highly recommend that you find a therapist who can do it. And this is very efficient, because a lot of my patients have said that they have only needed a few sessions of this to feel better. So it's not actually a long-term therapy. It is short and sweet in some cases. So we have talked about energy. Let's just talk a little bit about thinking and feeling, because we also get stuck in those realms after trauma. We think about certain things and then we have a feeling response, and unfortunately it repeats itself. We cannot even be present, and that is a big problem. So we're living in the past. Now for this I'm just going to point you towards Dr. Joe Dispenza. He's done an immense amount of work. He's given his entire life to this beautiful work that he is doing. He's got some wonderful meditations on YouTube, and his work is aimed at helping us move from the past into the present, so that we're not, ruminating about past events, but we are here in the present. We are open to what the present can bring. And have a look at his work. I will maybe link one of his videos below my video, because his work is tremendous. You can listen to his talks on YouTube and also do his meditations. He's got a few wonderful books as well. So that was working in thinking and feeling. Now I just want to mention a practice, because the other component in staying sane in our modern world with a ton of pressures, a ton of trauma, and also a whole lot of meaninglessness, it's a difficult world to live in. So I'm convinced that all of us need to have a practice. So it could be a type of meditation. For some people it is walking. For some people it is swimming. Whatever you do mindfully. For me, I have done a separate video on this. Right now it is tantric meditation, because the reason that I think it is very effective, in my experience, it really helps you create those moments of feeling whole and feeling good. And then you can stretch them out into the rest of your life if you practice it regularly on an everyday basis. We all need to have a type of practice or mindfulness that works for us. And I don't think apps go as far as an actual practice where you learn the skills. So learn the skills maybe from an app, but I always think investing in a coach is a really good investment, because this is how you evolve, this is how you move on. So let us just summarize what we've talked about, right? So having a therapist is a wonderful thing, but you need to be very, very careful about how you select a new therapist. And I will give you some examples of what doesn't work for me. You may be different, but it may be relevant. So for me, a therapist has to be able to be humble. They need to view me as an equal. They cannot look at me as somebody who is ill and needs lifelong therapy. That's just, that is a joke, because then everybody needs lifelong therapy. They need to be able to evolve and learn new skills. If they think that they know everything, for me that doesn't work, because that's a lie to start off with. Nobody's in that position. If a person thinks they know everything, they have stopped learning, and that is the worst place to be for me. Certainly they cannot do therapy. I recommend somebody who has many skills. It works really well. I always encourage, like I have a personal coach, and when I work with her, I always encourage her to use all her skills, mix and match whatever she feels appropriate. I give people that creative freedom, and same with a therapist. So you can look for a therapist who does talking therapy, who does energy work. There are therapists who do energy work, also EMDR, and just see what kind of rapport you have with them. If you have this trust, if they respect you, I think this is tremendously important. So for me, for therapy to be effective, the therapist has to respect their client for what they're going through. There can be no pity, because that is a false position for a therapist to have. It's very false, because the way I feel about it is like, I have respect for my patients for the difficulties that they're going through. It takes courage, it takes strength, it is painful. Respect and empathy is of paramount importance. And also you have to develop a really fine feeling for this, if the empathy is genuine, because sometimes it is just superficial and it's not genuine empathy. And in my opinion, that makes the whole therapy highly ineffective. So if you think your therapy is not working, you're not imagining it. Change your therapist, right? And the other thing is, have a practice, have either meditation practice. Look at all the types of mindfulness out there. It is a big field these days, and find something that works for you and do it consistently every day. Sending you lots of love. I hope this was helpful. If you have questions, you can email me. See you soon.